COVID-19 update. I'm Dr. Jeremy Adler. I'm the Tippecanoe County Health Officer. I am pleased today to be joined by Mayor John Dennis of West Lafayette, Dr. Chris Mansfield from IU Arnett, and Dr. Esteban Ramirez from the Protect Purdue Health Center. I'll start today by reviewing our local COVID-19 data. This first slide reviews the 5 data points that the Health Department has been monitoring for COVID-19 here in Tippecanoe County. The first is the number of new confirmed COVID-19 cases. The second is the percentage of COVID-19 tests that are positive. This is also known as the percent positivity. The third are the number of COVID-19 hospitalizations, including the number of patients in the intensive care units and on ventilators. Fourth, the number of emergency department visits for respiratory illnesses in our county. And lastly, the number of deaths due to COVID-19. This next slide summarizes our current data. As of today, we have had a cumulative number of confirmed cases of 1,500 in the county. Of those, 543 are considered to be active cases, 944 have recovered, and we have had 13 deaths. That's one additional death from our last press briefing. This 13th death was also, like the others, in an individual over the age of 65 with other health conditions. In the last 28 days, we've had 481 new cases, and in the last 7 days, 131 new cases. This next slide shows our number of new cases by day, going all the way back to mid-March when COVID-19 began here in Tippecanoe County. And as you can see from the general shape of the curve, there was a peak in early May, followed by a decline in the number of new cases into June, and then as we headed from June into July, the numbers started to climb again, and they have been in general climbing since that time. You'll also notice, though, that the numbers of new cases do go up and down from day to day. So another way of looking at this data is by calculating the average number of new daily cases by week. And you can see the shape of this curve is similar to the last curve with a peak in early May, followed by a decline in new cases, and then starting to rise as we headed into July, and it's continued to rise from that point. Currently, this week, we are averaging 20 new cases per day, which is the highest number of average new cases that we've had since the pandemic began. This next slide shows our testing data for the county. The cumulative number of individuals tested in Tippecanoe County is 29,074. The percentage of cumulative tests that have been positive is 5.2%. Looking at our tests for the last 7 days, 3,091 individuals have been tested here in the county in the last 7 days, and of those tests, 4.2% have come back positive. The World Health Organization has set as a goal for the percent positivity 5% or below, so I'm pleased to show that we are below that for this week. For the state of Indiana as a whole, 6.8% cumulatively for their percent positivity and 5.2% for the week of August 12th through August 19th, which is favorable compared to the nationwide data shown there of 9.1% and 6.3% for this country as a whole. This next slide shows the trends in our percent positivity by week going back to early May. And you can see that our numbers have followed a very similar shape of a curve to our case numbers and reached a low in the middle of June of 2.1%, increased heading into July, and then have decreased, then increased, and decreased and increased again, hovering around that 5% level for the last several weeks, and again, this week being at 4.2%. This slide shows our local hospital data. The top line are the number of patients hospitalized for COVID-19. These are the peak numbers for each week going back to the end of May. So this past week, on our highest day, we had 21 patients hospitalized for COVID-19. The second line is the number in the intensive care unit. 4, and the bottom line, the number on ventilators, 2. So we see a little bit of an increase in the number of hospitalized patients compared to the last several weeks. And lastly, this slide shows our number of emergency department visits for respiratory illnesses by week. Again, this number has been trending fairly steady for the last month or so, a little over a month in the high 100s, currently at 182 ER visits for respiratory illnesses this past week. So in summary, we are seeing an increase in the number of new cases overall, but I'm encouraged by the fact that our percent positivity has dropped in the last 7 days to below 5%. The key steps for all of us to continue are to continue wearing our face coverings as mandated by Governor Holcomb, continue with our social distancing practices of maintaining 6 feet from others when we are in public settings. We should be avoiding crowds, especially when those crowds are not adhering to social distancing or face covering practices. We should be washing our hands frequently and, of course, staying home when we're sick. Continuing to do all these measures will help our community come out ahead in this pandemic. And so these measures are very, very important for all of us to continue. And I understand it's challenging for all of us to do these things after so many months, but these are the things that are going to help us stay healthy and keep our community moving in the right direction for this pandemic. Those are all the remarks that I had for today. I'd like to open the floor to any questions from the media or from our Facebook Live audience.
Dr. Edler and Dr. Ramirez, how do the numbers we're seeing from Purdue factor into what we're seeing reported by the state at this point? Do they square up apples and apples? And then also, as we start testing at Purdue heavily, what, 10% a week? What should we expect those numbers to do, those peak numbers, so we're in context with what we've had all summer long and what's coming here in the next month or so?
You want to go ahead?
Sure. So I think you're going to see an increase, obviously, in testing, of course. Because we're doing surveillance testing, we're doing testing in folks we don't necessarily expect to be ill. So I don't anticipate the positivity rate really increasing all that much. But of course, we should find a couple asymptomatic individuals with that surveillance testing.
Yes, thank you. The Purdue data, of course, factors into our county data and is part of what we as a health department watch closely. And we've been very pleased with the assistance of the Purdue Health Center in helping to keep the university community healthy.
With the occurrence of college parties starting happening last week and over this weekend, has there been an increase in cases due to that at all?
It may be too early to tell because there's an incubation period of up to 14 days, but I would not be surprised. This virus is highly contagious and it spreads very easily in settings like that where you have large crowds who are gathering, particularly without following social distancing or face covering guidelines. So that could very well be the case.
If Purdue students do begin to contribute to a larger spike in cases, do you think that further restrictions on businesses will be put in place to sort of offset that increase?
I think that depends on what direction our data goes, and it's really difficult to predict what impact that will have on our county as a whole. So we'll just have to take that one day and 1 week at a time.
Thank you.
And to your point, just in the short time that the students have been back, there was a heightened degree of awareness of the virus. They also are well aware of the potential of passing it on to others and the fact that they're not asymptomatic for up to 2 weeks. The other thing is that we're dealing with an age group that is at the peak of their experimentative behavior. And I know that in the city of West Lafayette, with our police department and with our civilian enforcement groups, the continued suggestion and recommendations of appropriate behavior is probably the most is the message that we're communicating the most. The one challenge that we have is dealing within the neighborhoods, and because of the size of the houses, the limit of room space within those neighborhoods, it's very difficult to limit the number of people that go there, because obviously we're not invited to the parties. And the second thing is to make sure that if they choose to behave in a way that's not responsible, that they don't infringe on the permanent residents' lifestyles. So we're making those messages known. There was a high degree of understanding. Now we just need to work on a willingness to comply.
Question from Facebook Live. Do our numbers include numbers from Purdue, or is that being tracked separately?
Dr. Ramirez.
So again, keeping in mind that we have a large proportion of our testing that's still coming in from the test all strategy, a lot of those are out of state. So that information would go to this appropriate state. So if they tested, for instance, somebody from California, it would go to the appropriate California Department of Health. Those that are here locally, that would be reported to our state and county.
Following up on the question about restrictions, we talked a little bit about what Bloomington did with limiting size of gatherings. Is there any movement to do something similar like that? And talking about the police, how many times has your department sent things to the Dean of Students since students have been back with the Purdue Pledge? We know there have been several cases, but how many times?
Yeah, I'm not sure on how many times. And the challenge that we always have, regardless of what restrictions we put on either its student population or static population, is an issue of enforcement. Hypothetically, if they're inside of a house, there's no reason for us to actually ask or to initiate entry. We just won't know. Being quiet and be it behind closed doors, until we get X-ray vision, there's really not that much that we can do. But for the most part, the students that are coming here understand the circumstances that we're all living under. They understand the appropriate way to behave. If they make choices that are contradictory to that, we will do everything within our power, which means everything that we're aware of, to go ahead and encourage compliance or mandate compliance. But the Purdue Pledge, as I understand it, includes their behavior off campus. And the presumption is should they do something that is obviously going to put the static population of West Lafayette in jeopardy, they'll be brought in front of the appropriate board or commission and be dealt with appropriately.
So if I'm correct, the dashboard that's being refreshed every week is showing new positive tests, but not the total amount of active cases. Is that correct?
Are you referring to the Purdue dashboard?
Yes. And if so, why is that the case?
Sure. So actually, they are reporting active cases as well.
Okay.
So I can give you some data for this particular week if you're interested. We did do 2,145 tests. We have 51 students that were positive. And again, this is all available on our dashboard as well on our website, protect.purdue.edu. And we had 3 employees that were positive for a total of 54 positives. That gives us a positivity rate of 2.52 for this week.
Can you say how many students are currently in quarantine?
Then I would need to look into that data in particular. We know that we had a larger amount of, we had a couple different areas that were involved where we had positives, and so there's a lot of them were congregate housing areas, so those individuals are in appropriate quarantine spaces and as well as in appropriate isolation spaces as well.
Thank you.
Question from Facebook Live. Currently, how many people are allowed to gather inside?
Okay, so the gathering sizes are set by Governor Holcomb's executive orders. Currently, gatherings are limited to 250 people, provided that social distancing can be maintained. Now, the governor also allows for organizations to have gatherings larger than 250 people as long as they come up with an appropriate COVID-19 safety plan that is submitted to the health department and reviewed by the health department. So it is possible to have gatherings larger than 250 people, provided a plan as approved by the health department. I should point out that the governor's executive order does exclude religious services and religious gatherings from that size limitation, provided that they are able to socially distance appropriately.
How often will the database be updated? The state's is every day at noon. And also going to go back to, is there any movement on restrictions in size of gatherings like Bloomington tried to, or is doing with an order along those lines? And then with the question on quarantine, 600 beds for isolation at Purdue, and how many of those are being used right now?
I'll start off with the quarantine question. We have approximately 800 to 900 now availability, and the exact percentage I don't have readily available, but we do have ample space at this point. We're not using nearly a high capacity of that space, thankfully. Can you repeat your first part of your question as well?
How often will you be updating?
Thank you. Yes, so the dashboard, we're hoping to get it up on a daily basis. At this point, we're still working on working out the kinks at this point with data, making sure that we can get it all refreshed in an appropriate time frame. But that's our eventual goal, is to have a daily dashboard for everyone.
And then there was another part of the question about restrictions for gatherings.
Similar to the gathering rule that Bloomington made.
Oh, sure. Sure. Currently, we don't have a plan to do that in our county. That could change if our local data trends in an unfavorable direction. But currently, our plan is to stick with the capacity and gathering limitations set forth by Governor Holcomb in his executive orders.
Question for Marvin Bills with News 18. Does Mayor Dennis or Mayor Rzorsky plan to mandate stricter social gatherings?
He didn't show up. We're looking at obviously we defer to Dr. Adler for guidance. In a college community, when you talk about social gatherings, it could be 2 people, it could be 200 people. And we can only enforce what we're aware of. Oftentimes, when we're made aware of something, as soon as we show up, magically people disappear. And that doesn't help us at all, because what that could potentially do is scatter people into an area where they're going to create more havoc. We have not yet had complaints of large groups. Obviously, in a college community where the sports activities are going to be limited this year, the hope is that the students will understand. And again, I'm going to pause here for a second. There's a presumption that the students are going to arrive here and behave irresponsibly, and that's not true. They've been doing a pretty good job. There's the odd positives that we've had in some of our neighborhoods, but those have been dealt with, and we feel comfortable with that. But I think currently people are aware of the circumstances that we're all living under. And look around you. I mean, everybody in here's got a mask on. That's not necessarily what we are used to seeing. And the students, most of whom come from communities that have similar or even more restrictive guidelines to abide by. We know that the age group is generally known for their tolerance of experimentation. But this isn't just a matter of doing keg stands. This is a matter of public health. And it's a matter of behaviors that can not only affect you, but could affect people that you care about. And plus, Purdue has a lot of very direct and punitive consequences should people choose to misbehave. And I think all that together allows for us to have some degree of comfort about the course of actions that we're taking.
Given the first week at Purdue, do you see any other kind of adjustments in Purdue's plan? And I know we've already kind of dealt with it in the cities and the health department plan. And also for Dr. Adler, is there any chance that you'll be pulling back on the midnight curfew, or how has the restaurant order been going in the last 2 weeks?
Okay. Sure. So the restaurant order, we're monitoring our local COVID-19 data very closely. And as I said, when I issued that order, that the order could be amended in either direction depending on what direction our data goes. So we're watching that closely, and if things are looking favorable, then we may be able to pull back on some of the restrictions there. And so it's my hope, of course, that things go in the right direction, that we're able to do that. But it will depend really on what direction our local data goes.
With regards to Purdue, we have protocols in place, and we're using them as we're following through with the protocols, and things are working as intended. So we're at this point, as with any process, we continue to refine and see how we can improve every single day by looking at data and trying to make decisions based on that.
And for the city, actually, I've had bar owners stop by my office, and they've expressed a willingness to cooperate. One bar owner actually gave me his protocol, and it was a very well-written, very concise document about specifically how they're going to move forward with the current restrictions that we have in place. And the other thing is that, we need to recognize that Purdue and West Lafayette have a different population base than Lafayette. And when we talk about dealing with a college population, there's a lot of things that we can say yes and no to that might challenge some of the population base in the city of Lafayette. But the truth is that we're all doing the same thing for the right reasons. And, even though the population base might be significantly different, the potential of contracting and spreading the virus is not. So we just need to be vigilant. We need to be careful, and we need to make sure that we all proceed cautiously when we start loosening things up based upon the data. If we move too quickly, we'll be right back to where we started.
Dr. Ramirez, can you confirm how many Greek life houses on campus have confirmed cases?
I'm not going to say a number, but I can tell you it's a handful of organizations. So, but we know that most of our cases come from one particular conjugate housing area.
Question from Emily Seiberg with WBAA. Aside from the potential COVID spread at parties and gatherings, what's the level of concern around effectively stopping COVID spread among students living together, whether in a residence hall or off-campus housing?
So the key part to trying to manage this is, of course, following the Protect Purdue Pledge. Wearing a mask when you are within 6 feet of anyone. You should be wearing a mask anytime that you're out and about, moving around. Good hand hygiene, of course, is extremely important. If one individual becomes a high-risk contact, so let's say they were exposed to someone who was positive, we would want to try to find out, can we quarantine that individual safely in that space, and if not, then we would remove that person and put them in a safe place to quarantine, leaving minimizing any spread of infection with the other individual in that room.
Question from Marvin with WLFI. Can Dr. Ramirez confirm that 2 Greek organizations on Purdue University's campus were shut down previously due to COVID-19?
We haven't shut down anyone, but what we have done is we've quarantined individuals in the housing.
Question from Facebook Live. Can you please explain who should isolate, quarantine if a family member is directly exposed?
Sure. So if a family member is directly exposed, the family member who was exposed needs to quarantine. And that would be for 14 days. During that time, that family member, of course, should be monitored for symptoms. If he or she develops symptoms, then he or she should seek medical attention and would likely be tested. The other family members would not need to quarantine unless the family member who initially was exposed then subsequently tested positive to COVID-19, and then they would be considered close contacts of an exposed, a confirmed positive individual.
Question from Facebook Live. Can bars go back to bar seating while maintaining distance at 50% capacity?
That's going to depend really on the direction that our local data goes. certainly accommodations and amendments to the order are not off the table, and they will be considered certainly based on our local data.
Last question from Facebook Live. Will the new CDC guidelines for testing change the way we are testing locally? For example, if you were in contact with someone who has COVID-19, you do not need to be tested unless you have symptoms.
Yes, so the CDC did make a change to one of their guidelines earlier this week. They had previously recommended that contacts of confirmed cases be tested. That recommendation has changed to no longer requiring testing. It is still available for those who want to be tested. But if you are an asymptomatic contact, that does not, no longer would require testing at this point.
I understand. We understand that Purdue's numbers just coming in were 1%. Now we're getting up to 2% with more symptomatic people coming to do that. Should we assume that we're just surrounded by 1% everywhere? I mean, is that kind of the message that we should get? Not to scare anybody, but just in general terms. This is the first time we've had mass asymptomatic testing, or am I overstepping just that thought process? Does that make sense?
I think that, one of the things that we learned about COVID-19 from the Indiana University School of Public Health study that was done earlier this year, they've done, I think, 2 or 3 parts of the study, there's still some more to come, was that statewide, we learned that the prevalence of COVID-19 is about 2%, 2.8%, and about 40 to 45% of people who have COVID-19 in Indiana are actually asymptomatic. So hearing that, that's the reason why we all need to be practicing all of these preventive measures, the face coverings, the social distancing, the hand washing, avoiding crowds, staying home when we're sick, because the truth of the matter is that COVID is out there. It's in our communities, and with a large amount of asymptomatic carriers who could easily spread the disease, there's no way to know, if we're going to be exposed on any given day. So that's why it's so important for all of us to take these measures and act accordingly, act smartly so that we can stay healthy.
If the case against Mayor Dennis is successful and the mask mandate would be lifted, can the county pass its own mask mandate similar to that?
The county could do that, but I should point out that there currently is a statewide mask mandate ordered by Governor Holcomb, and the way that Governor Holcomb's executive orders work is that no local jurisdiction in the state of Indiana can have any sort of measure that is less strict than the governor's. You can have more strict measures, but nothing less strict. So if for whatever reason that case is successful, masks would still be required in West Lafayette, just as they would be throughout the state of Indiana. I didn't mean to speak for you, Mayor.
You kidding me? If I say something, I might have to testify in court about it. So.
We do have one more question from Facebook Live. Should gyms, dance studios, et cetera, be enforcing social distancing if they are not requiring face masks during exercise?
Absolutely. Even with face coverings, we should be practicing social distancing. That's just part of our smart preventive actions to prevent the spread of COVID-19. So absolutely.
Can you give a sense of how well you think the K through 12 opening went since Thursday? I know we've got some cases, but I don't know if you feel that those are alarming or to be expected, and have there been things reported to the health department that have been kind of hot topics that you need to adjust for parents, students, and for schools?
Sure. Yes, so there have been some cases, of course, in our K through 12 schools, and we expected there to be cases. So we went into it expecting that this would happen. We've been working closely with the schools, and the schools have been doing actually a really excellent job in working with the students and the parents to help with the isolation and getting the right medical attention, and then identifying close contacts who need to be quarantined. So the process itself has gone well so far. It's a time-consuming process that's not easy, and especially since it's all new to the schools and to the school staff, there's definitely a lot of work that goes into this. So it's a process, though, that I think so far has gone well. And of course, we're at the health department monitoring everything very closely and providing as much assistance as we can to our local schools.
Question from Emily Seiberg with WBAA. Do the doctors that are here today agree with the new CDC testing guidelines?
Okay, I'll begin with that one. You know, I think that I do agree with it. You know, for asymptomatic contact, the most important measure is quarantine for 14 days. And it's important to point out that even when the CDC was recommending testing for asymptomatic contacts, they did also state that even if that test is negative, the individual still needs to quarantine for 14 days. So in that regard, it doesn't change the quarantine, which is really the most important thing from a public health standpoint. And of course, I should point out that during that quarantine process, if that asymptomatic person becomes symptomatic, of course, then they would be tested to see if they indeed have COVID-19. So yes, I think the change in the recommendation, from my standpoint, is fine.
I also, I would agree with the CDC changes. I also think that it also depends on the environment. So Purdue has a high density population. So we have a lot of students in the area. So identifying someone who converts to positive quickly is to our benefit, and to contact trace appropriately. So that is something that we're going to review as a medical advisory team to see if that's something we would apply to our particular protocols. But again, we can see the advantage of also testing more aggressively in what the CDC is recommending because of our unique population and in our setting as well.
Sure, I can answer, yeah. So I think it kind of depends, really. For the general United States, I would say yes. But that's the only reason I say yes is because we're not great at contact tracing. If we were great at it, then I would say, well, it doesn't make a lot of sense. We should know exactly who's positive and trace that all across the United States. But since we're not great at that, it doesn't make a lot of sense when you're quarantining them anyway. Just like Dr. Adler alluded to, if we're doing the right things, then I agree with the CDC's statements that they just approved.
I'm not a doctor.
You can still comment.
I can still comment. Do what they say.
You know, we've asked this through the months. Is there anything in what we'll see at Purdue, either through the group housing kind of things that you're seeing right now, or any of the numbers that say we're on par with Notre Dame, for example, or Butler having to pull back? I know that's going to be a question for President Daniels and the trustees, but what should we be looking for from the health department or from Protect Purdue Health Center that would signal we're getting close to something like that?
Sure. Do you want
You
me
want
to
to
begin?
start?
Okay. So, you know, from the health department standpoint, you know, we are monitoring the 5 data points that I shared with you today. And in addition, we would take into consideration things like testing capacity, absenteeism rates for students and staff, case clusters, the size of clusters, the rate at which they're forming, things like that. So as I mentioned before, there isn't any one particular measure because there are so many possible combinations of measures that we would monitor for trends and act on those trends. So, you know, it's so early in the school year to even predict what's going to happen next week. So it's hard to say from a health department standpoint what direction things will go. And we of course, hope for the best and continue to monitor things very closely. But we'll have to take things, one day at a time, 1 week at a time.
With regards to Purdue, we're of the same school of thought. There's a lot of different factors that go into a decision like that. It's not just going to be one particular number. We're looking at, do we have isolation space? Is severity going up? What does the community look like with regards to resources? So there's a lot of particular questions. I mean, we have frequent meetings on purpose so that we hear and we keep the pulse of what's going on not only in our community but also of the university. Because I think it's a vital relationship to have to understand, what's going on with one region so that we can react accordingly in the other parts as well.
And not to keep belaboring that point, but walking through campus, once BGR got done and you really had the groups kind of subside, a lot of people saying it feels different than a regular semester, feels like it's less crowded. Give me a sense of whether you think that's, that by design worked, and whether that needs to be adjusted in any way, as only half the students are going to a class in a high flex moment or a high flex method, that kind of thing.
Well, we hope it definitely is working. We definitely have de-densified, the campus. Approximately 60% of our staff are working from home. Professors are many times teaching hybrid courses where there's some parts of it that is in person, but they also have a lot of online components, and that was purposely built so that if somebody has to quarantine, if somebody has to be in isolation, they can still be successful in their courses. So we really, a lot of thought was put into how to plan courses so that we can flex according to what's going on our campus. I think we'll continue to see that level of de-densified space throughout the rest of the semester as well.
Do you feel that same change? I mean, just in your own personal experience.
Absolutely. When I compare last year versus this year, I see the exact same situation. It looks very de-densified in comparison to last year. What I am encouraged by is when I drive through campus, and I purposefully do that to kind of evaluate how are we doing, is the message getting out, and I do see a lot of students wearing their masks, and that's great. That means we're following through on the Protect Purdue Pledge.
Question from Facebook Live. Would it be better to let everyone get COVID-19 like we did with chickenpox? Would that give us herd immunity?
That's a great question. So herd immunity usually requires about 70% of the population to become infected with the contagion. So the road to herd immunity without a vaccine is an incredibly painful road. If you think about 70% of the population is an enormous number of people becoming sick. And if just a small percentage of those who become sick become very sick and require hospitalization, that could easily overrun our hospitals. And then a small percentage of those individuals would unfortunately die. And when you're talking about 70% of the population, you're talking about a lot of death. So it would not be the right approach without a vaccine to just let everybody become infected. It would be a very difficult approach to this problem.
May I make one comment to that? I add on to Dr. Adams. So I completely 100% agree, and there's no way that our current healthcare system in the United States could handle if we all of a sudden infected 60 to 70% of our population to try to achieve herd immunity. It just would be physically impossible. We don't have the space to do that. So I would just add that in there. I mean, because what, 5.5, 6 million is the total positive United States, and you're talking, if you have a population of 350, 400 million people, 60 to 70% of that is a pretty big number. So I would say no.
Okay, well, I think that's all of our questions for today. So thank you all for joining us, and we'll see you next time.